Hi viewers, in this video we are going to discuss about expected weight calculation formulas. My name is K. Priyadarshini, working as a lecturer in Madras Medical Mission College of Nursing. The objectives of this videos are define what is expected weight, explain the importance of calculating expected weight, and enumerate the various formulas for various age groups. We all know that group monitoring is essential in children's health. Not only children's health, for all the classification, the first step we used to do while coming for the hospital, or if we are going to the community area, we used it to collect the HTTP. The second one is assessment. Okay, we are the baseline data we able to get by assessing the height and weight. So weight is one of the key growth indicator, and it is used in various areas like community surveys and clinics. Definition. What is expected weight? Expected weight means standard weight for that particular age group. Usually we used to compare this expected weight with the actual weight. Why we are doing this? Because it is very much important. Usually we used to assess the nutritional status of the child, or any other classification, whether the person's weight, actual weight, is compared with the standard weight, whether it is equal, overnourished, or any other kind of malnutrition. To find out that, we used to check the expected weight. Importance of checking expected weight in community health. Why we are checking every time in the assessment? We used to calculate the expected weight for the persons. Why? For detecting the malnutrition as early as possible, and for planning nutritional program. For example, if in some area the people residing in that area, most of the members having some malnutrition related health problems, we able to identify with the help of calculating expected weight and monitoring ICDS and the school health services. For that purpose, it is very important to check the expected weight for all the classification. First, we will see what is the formula for calculating expected weight for infant. Infant 0 days to 12 months, we use it to term as infant. Okay. Formula for calculating expected weight for infant. Usually, during at the 5th month, we use it to tell as birth weight doubles by 5th month and triples by 1 year. For example, if the birth weight is 3 kg, okay, at 5th month it will increase up to 6 kg. That is the expected weight of the 6th month, 5th month infant. Okay, at 1 year it triples. So 3 into 3, 9 kg. Okay, usually what is the birth weight of the Indian children? It is around 2.7 kg to 3.5 kg. We use it to term as normal birth weight babies. Okay, in different books it's giving different rates, but usually ideally we use it to tell us 2.7 to 3.5 kg. It's the ideal birth weight of Indian children. Formula for 1 to 6 years. The expected weight calculation formula is age in years into 2 plus 8. Example, I am going to calculate expected weight for 4 years baby. 4 years, child means age in years 4 into 2 plus 8. Okay, for 4 years child, the expected weight is 16 kg. Okay. Next, we are going to see expected weight for 6 to 12 years. The formula for calculating expected weight for 6 to 12 years is age in years into 7 minus 5 divided by 2. Example, if the child age is 10 years, we should multiply the age by 7. Okay, so 10 into 7, 70. Okay, and subtract by 5. 70 minus 5, 65, and we have to divide by 2. So 65 divided by 2, 32.5. The final answer is 32.5. So for the age 10, the expected weight is 32.5. Next, we will see the formula for assessing malnutrition. According to Indian Academy of Pediatrics, the formula for calculating malnutrition is expected weight equal to degree of malnutrition equal to actual weight divided by expected weight into 100. Okay. Example, the actual weight is 12 kg and the expected weight what we calculated is 16 kg, means we able to calculate the degree of malnutrition by applying this formula, actual weight divided by expected weight into 100. Okay, so 12 divided by 16 into 100, we able to get this percentage, 75%. Okay, this formula is given by Indian Academy of Pediatrics. Once again I am repeating, formula for assessing malnutrition is degree of malnutrition is actual weight divided by expected weight into 100. Based on the percentage of expected weight, we are able to inference what degree of malnutrition the person belongs to. 90 to 100% means that comes under normal. The person is not having any kind of malnutrition. If the percentage is 75 to 89%, mild malnutrition. 60 to 74% moderate malnutrition. Less than 60% severe malnutrition. Okay. Factors affecting weight of the individual: the nutrition, infectional status, socioeconomic status, genetics. These are all the factors affecting the weight of the individual. Role of community health nurse. Regularly we have to monitor the weight of the child. We have to identify the malnutrition and nutritional status of the children, and we have to counsel the mother how to take care of the children and the family members. Yearly referral we are able to do with the help of assessing degree of malnutrition, and nutritional education we are able to give. These are all the roles of community health nurse after assessing the expected weight and assessing the degree of malnutrition. Advantages of using this formula: it is very simple formula, we are able to use it in all situations, and quick field calculation, useful in rural areas, no special equipment needed. So these are all the advantages of the formulas. Conclusion: expected weight formulas are essential tools. It helps to detect the malnutrition as early as possible, important in community health nursing practice also. In this video, we have seen what is expected weight and what is the important of calculating expected weight, and we have seen for infant what is the formula, and for 0 to 6 years what is the formula, 7 to 12 years what is the formula, and what is the important of assessing the expected weight, and how to calculate degree of malnutrition, and role of community health nurse in assessing the expected weight and degree of malnutrition. Hope you are all able to understand this content. Thank you viewers for your support.